is a break or crack in one or more bones of the hand. This injury is mostly caused by direct fall. Sportsperson and old age people suffering from osteoporosis are at a higher risk of broken hand. It is important to treat a broken hand as soon as possible, or else the bones might not heal in a proper alignment, which might affect the ability to perform daily activities. Early treatment will also help minimize pain and stiffness. A hand fracture is caused by physical trauma such as direct blow from an object, heavy impact, crushing of the hand or twisting of the hand. These injuries usually occur during vehicle crashes, falls, contact sports like hockey or football, and punching. The symptoms of a broken hand depend on the severity of your injury. The most common symptoms are severe pain, tenderness, swelling, bruising, difficulty moving fingers, numb or stiff fingers, worsening pain with movement or gripping, crooked finger or fingers, audible snap at time of injury. Sometimes it can be difficult to tell if the hand is broken or sprained. These injuries can cause similar symptoms even though each one is different. While a broken hand involves the bone, a sprained hand involves a ligament. A sprain occurs when a ligament is stretched or torn. Symptoms of sprained hand include pain, swelling, bruising, inability to use the joint. If you think you have a broken hand, until you can seek medical attention, follow a few first aid procedures. Avoid moving your hand. Try your best to immobilize your hand. Apply ice. To reduce pain and swelling, carefully apply an ice pack or cold compress to your injury. First aid is done to limit further injury. It can also help minimize pain and improve recovery. The diagnosis procedures include physical examination. The doctor checks the hand for swelling, bruising, and other signs of damage. They might also examine the surrounding areas like your wrist and arm. This will help them determine the severity of your injury. Medical history. This allows the doctor to learn about any underlying conditions such as osteoporosis or a previous hand injury. An X-ray is used to identify the location and direction of break. It can also help to rule out other possible conditions like a sprain. The purpose of treatment is to help the hand heal correctly. With proper medical help, the hand will be more likely to return to its normal strength and function. Treatment options include cast, splint and brace. Immobilization limits unnecessary movement, promoting proper healing. It also ensures that the bones line up correctly. Metacarpal fractures are often difficult to effectively mobilize and will likely require surgery. Pain medication. The doctor might have to take over the counter medication to control pain. However, in cases that have more serious injury, they might prescribe a stronger pain medication. They'll also recommend the appropriate dose and frequency. Be sure to follow their directions. Surgery. A broken hand usually doesn't require surgery, but it might be necessary if the injury is severe. It may need metal screws or pins to keep the bones in place. In certain cases, a bone graft. Surgery is likely necessary if the injury involves an open fracture, meaning the bone has pierced the skin, and complete crushed bone or a bone extending to the joint, loose bone fragments. Another common cause of surgery is if the bone is rotated, which can rotate the fingers as well and affect hand function. A surgery might be needed if the hand was already immobilized but didn't heal correctly. In general, broken hand recovery takes 3 to 6 weeks. It would be mandatory to wear the cast, splint or brace during the entire time.